on a client who had a receding hairline and corner, and we'd be attempting to do at least 2,500 grafts on him, and we will be using the FUE method. So he came in a couple of times for me to draw the hairline, make it perfect for you. So on average, from the mid eyebrows to the mid hairline for Caucasian is around 7.5 to 8.5 centimeter, and for this client it turned out to be 7.75. And again, no hairline gonna be exactly the same, but as long as we're within the normal range in the bell curve. And the more narrow the face, the more arched back the hairline is. The more round the face, the more flat the hairline is. And then now for him, his hairline not just gone up, but the temple gone backward too. So if we don't bring in the temple, then he's gonna have a low hairline with a wide forehead. Yeah, he has hair, but it still look not natural, and you know, so this might be slightly off. You know, I'm a perfectionist when it comes to hairline. It's just more than just the surgical skill of the surgeon. The surgical skill will determine the density, and that's when I personally pull the hair graft one at a time, personally myself. So I'm doing that part. I don't put the hair in, and my nurse will do that. But I do 90% of the work. I'll be the one who design the hairline. I'll be the one numb you up, and be personally pulling the hair graft one at a time. But we'll get back to this. The artistic and aesthetic detail is really, really important to create a very natural hairline. And each person, when I do the hairline, is a custom work. Each person facial structure is different. So I build the hairline around an individual facial structure too. And for his 7.75, he could go down 7.5, but we just want to leave it 7.75 for now, because he can always lower that in the future. But if we do it too low, we can't raise it up. So you rather have a slightly higher. And again, as long as proportional. If you can turn this way, you can see he's gone backward. So we brought him in, and we can turn this way too. There we go. Let me look down a little bit. So there you go. And so from the midpoint, we measure to the temple on the side is 8.75. Again, it's from 7 to 9 centimeter. So his is 8.75 centimeter. And then we talk about zigzag now. There are two types of hairline. There's a soft hairline and a tight hairline. And the soft hairline has a bigger zigzag. And some people are more conservative. They don't want to draw attention to the hairline, and they want to look as most natural. And it's very soft. So we use a lot of root to grow single hair and with a bigger zigzag. And so it looks very natural. However, the drawback is it looks a little bit less dense in the front. And then on the other side, there's a tight hairline, so the zigzag will be smaller in amplitude. And then so the roots to grow single hair is less in the front, and then the root of 2 or 3 hair right smack in the front border, so you can see. And then that type of tighter hairline will look more dense, which is an illusion in appearance. And that's good. A lot of celebrities use that because they want to draw the hairline, to draw attention to the hairline, because they say, wow, look at my hairline, it's really nice and dense, and I have full set of hair. But you know, some people just don't want to draw the hairline, attention to the hairline. So it's depend on an individual. Now then you can have somewhere in the middle, and that's more common too, more popular. So it's, you know, some clients say that I don't want it not too soft because I want a little bit more density. Yes, I don't want it too tight where it draw attention. So you can go somewhere in the middle in the zigzag, and you just convey that information to me. For this client, he just he like nice density and draw attention, yet it's not too much. And so we go somewhere in between, you know, tight hairline and the median, and which we can achieve that as well. I'm very excited for him. He's a very handsome young man, and once you lose the hair, you look a little bit older. But now a year later, so we're going to do at least 2,500 using the FUE method. He's going to get his look back, with a low set of hairline and full density. We can bring out his eyes, his nose, and all the good-looking feature that God created for him will come back, and bring back his handsome look. And then, of course, his youth as well. So this is the art of hair transplant restoration surgery on creating the hairline. Again, hairlines are very complicated, but if you pay attention to all detail, the result is going to be fantastic. And for more information, you can go to my website at www.mhtaclinic.com or call 1-866-999-6482 or 408-356-8600. Thank you.